So Venetoclax's role, especially specifically in mantle cell lymphoma, is a bit unique. So unlike CLL, we don't really have a defined role for Venetoclax in relapsed refractory mantle cell lymphoma patients. It is being explored in combination with ibrutinib in the simpatico study in second line for relapsed refractory MCL patients, and they will also have a first line regimen as well in that study to evaluate the combination in untreated MCL patients. Now, specifically looking at those who fail to respond to Venetoclax, we're going to look in the third line and beyond space. Brexucabtagene or Tecartus is a CAR T agent that's FDA approved, and that has shown thus far to have high overall response rate and a very impressive duration of response. All that, unlike what we see in patients with diffuse large B-cell lymphoma, there does not appear to be a plateau. So these patients do appear to be continuing to be relapsing as further time goes on with Tecartus. Coming down the pipeline, there are some other agents that also are utilizing T cells, so there are bispecific antibodies that are being studied. They appear to be quite promising, but they are only available in clinical trials at this point. There are also the ROR1 antibody are being looked at as versus a naked antibody, a drug antibody conjugate, and also with a bispecific target in this epitope, which is present on mantle cell lymphoma. And recently there was a FDA approval for the non-covalent BTK inhibitor Pirtobrutinib in that space. I'll bet Pirtobrutinib is probably going to be better, more situated with the other covalent drugs, as if you look at those patients who actually have failed a BTK inhibitor, the duration of response to Pirtobrutinib is much shorter than those who actually stopped the BTK inhibitor for intolerance, likely indicating that drug is probably not going to be a true sort of savior for post-BTK failures or those necessarily who fail Venetoclax after a BTK inhibitor. It should probably be slotted in a second line setting, and will likely also be explored in combination with Venetoclax moving forward.